So one of the questions raised from the glute video was, I feel it in my back a little more than my glute. Is that where I should feel it? So we want to feel it in our glute, but what I want to tell you first off is, did you know that your glutes, they come right up here, they insert into the back of the bony bits of the hip, right? So it sits pretty high. So sometimes when people talk back, they could be talking here. It's kind of just make sure like we sort of know what area it is that we're talking about first. But if you are feeling it in the back, the common reason this is maybe we're not using our core a little bit, but more often than not, it's probably because we're hyperextending or overextending the spine, and I'll explain what that is. So we have our feet hip width apart for the bridge, and in this case it was a single leg bridge, so I'm doing a single leg, and hopefully you'll be able to see this. So we float one leg up, got the other foot in position here, and I'm going to put some emphasis in this left foot here as I lift straight up. Now before I do, I'm going to engage my core. Okay, so we have the tummy muscles on, pull my shoulders down away from the ears, and then we're going to lift up. Okay, now right now you should be in a position where you have a straight line from the shoulder, the hip and the knee, right? Now what can happen if you just look at my hip closely, people go too high and then they get this arching in the back and it compresses the spine. So what you would encourage you to do is just make sure, just check that you're not lifting too high, and kind of play and see, where is it that you're feeling this, because if it's really high, it's more likely you're compressing the spine as well. And if you're pushing that foot into the mat, it does encourage a lifting of the hips, which then could overextend the spine there again. So you have to find that nice balance where you're trying to find that glute without lifting so high that it's hurting your back as well. And like I said, use your core too. What I would encourage for people who do have a overarched back, what we call lordosis or a sway back, is when you do a bridge, is just sort of start to tilt the hips back there a bit and flatten the back, and just play with the double leg bridge. And just try to kind of create that tilt or maintain that tilt when you come up. It does get a little bit tricky. You have to slowly move down and just try to think through that more. So hopefully that helps. Play with that, and then let me know if you're still having any troubles, and try stretching out the glutes and also stretching out the back as well, which I will show you in another video. Okay, bye.